It's my feel-good breakfast show.
Welcome back to Feel Good Breakfast Show. Expresso and S3, and some health advice is vitally important for you. Now, if I think about it, South African Minister of Health, Dr. Zweli Mkhize, has announced the voluntary suspension of the Johnson & Johnson COVID-19 vaccine rollout in the country, and COVID-19 registrations for the phase 2 of the plan have officially opened despite the rollout suspension. Now, Infectious Diseases Specialist Dr. Emile Reid had to be called in when I heard about this, and he's back to give us an update on the COVID-19 vaccine in SA. And if you have any questions, please feel free. This is your show. 021 110 552. Welcome, Doctor.
Welcome, Doctor.
Great to be back.
Do you know what? I was actually just speaking to G about this yesterday or this past couple of days, what's happening in Cape Town. It kind of just took my mind off the fact that we are still going through COVID. It is still real, you know, with the fires going on. It kind of made us forget that this is happening. Unfortunately not. COVID is still real. We're still going through this global pandemic. What are our numbers currently looking like in South Africa?
Well, if you think about it, guys, I mean, kids have gone back to school.
Yeah.
We're back at churches. People are congregating. Winter's coming. You got your jab. And the big issue currently is COVID is lurking. COVID is around. We need to probably double down as we sit here, wear our masks, social distance, sanitizing on a daily basis. Our cases currently round about 23,000 active cases. And what we experience within the hospital setup is the numbers slightly creeping up. Okay. You've already seen the Northern Province, Northern Cape, Free State, numbers are going up. So, I mean, that's a telltale sign. In India, I mean, million cases within 3 to 4 days. America, 80,000 cases a day despite being vaccinated. So I think we need to take cognizance of what's happening all around the world, and we need to double down.
I completely agree. You know, what happens psychologically with any population is when there's an air of vaccine, there's an air of taking my foot off the accelerator with regard to everything. But now more than ever, we should be putting the foot on the accelerator and doubling up, as you mentioned.
Yeah.
I do know that a lot of the anti-vaxxers, they had a lot of fun with the Johnson & Johnson vaccine being pulled.
Yes.
Almost like a told you so moment.
Yes.
And there were people talking to me and saying, die clots, meneer, die clots, right. I'm not going to do it. Why did government decide that the Johnson & Johnson vaccine should be pulled?
I think the one thing, it's all about benefit risk on the one side, and something interesting with regards to the anti-vaxxers and those people who said, I told you so.
Yes.
Those are the people who said, well, COVID has got 98% of people will get COVID and they're not going to get sick. So why should I be vaccinated? Those people are exactly the group who's worried about the 0.00004% of people who develop clots. So the Johnson & Johnson vaccine is an important part of South African armamentarium to fight COVID, and also in all other third world countries. So this vaccine have not been pulled. It's been a pause that's been put on the virus because, as you know, 6 ladies aged between 18 and 48 developed blood clots in America out of 7 million people, just to put it in context. And just to share with you, if you think of the context that we're talking about, the chances of you getting a clot, maybe 1 in a million, 1.2 million. Chances of being struck by lightning, 1 in 500,000. The chances of you developing a blood clot while you're pregnant, probably 1 in 4,000. Chance of you developing a blood clot while you have COVID, probably 16%.
Sure.
So if you look at the risk-benefit ratio, the benefit of this vaccine far outweighs the risk.
Yes.
And I think that is important. And people should remember, the more people we vaccinate, so should we get to 30 million people being vaccinated, surely there's going to be people having some form of abnormality. And whether that has got anything to do with the vaccine or not, it's going to happen, and it's going to be reported. And we are very happy in South Africa that the 300,000 healthcare workers that we have vaccinated this year have had no negative side effects whatsoever.
So then just clear that up, and maybe you can say this in your own words. Is there a problem with the Johnson & Johnson vaccination?
No, there is no problem with the vaccination.
Okay.
And I think the reason for the pause is purely because of safety concerns. And as you remember, what we were busy doing currently in South Africa was the implementation study. And if you do a study, you need to watch what happens to the participants. And obviously, if something should happen, you need to investigate further what's the next step, whether we need to stop this vaccine or whether we can actually proceed. And as you've heard over the weekend, the decision has been made to continue in the coming week with the J&J jab.
Well, I mean, this information is vitally important. We needed to hear this, and I know that there are many people who have some questions. And if you have any of those, stay tuned to the Feel Good Breakfast Show as Infectious Diseases Specialist Dr. Emile Reid answers all of your questions on that number, 021 110 552. And we'll have another part for you, giving you a bit more of an in-depth look into the vaccine. So stand by for that and stick with us right here on Expresso.
It's my Feel Good Breakfast Show.
Welcome back, everybody. We are continuing with our health discussion this morning. Now, infectious diseases specialist Dr. Emile Reid is still with us, and he's ready to answer all of your burning questions with regards to the coronavirus vaccine. Dr. Emile Reid, always a pleasure to have you with us.
Let's start off, before we get into some of the viewer questions on 021 110 552, I figured registration process, it's in full swing. We are in phase 2 now. Who should be registering on the electronic system at the moment?
Well, currently, because we know coronavirus infection probably affects the elderly more than
Yes.
the young people, the registration started on Friday, 4 o'clock, for those older than 60 years of age. So what you do is you log onto the system, the electronic vaccine data system. You register yourself, make sure you've got your ID book, address, telephone number, and within 24 hours you will receive confirmation that they have received your registration. And what will happen within the next few weeks, probably commencing round about the 15th of May, you will get an SMS to say, yes, your eligibility have been confirmed, and you can go to get vaccinated at the following site.
Oh, wow.
So there's going to be around about 2,000 sites that's going to open all over the country. So whether it's the private, whether it's the state sector, whether it's the GP or the pharmacy, people will be able to get their jab whichever is convenient for them and wherever is convenient for them.
That's exciting. It gives us hope. We
Brilliant.
also have a caller on the line right now. A very good morning to you. What is your question for the good doctor?
I just want to know, the courts cleared ivermectin, the use of ivermectin. Now, how come they're not talking about it? How come people is not getting it?
Okay, thank you for that question, caller. I think the important thing we must remember, ivermectin is an antiparasitic drug. And for myself as an infectious disease physician, I've been using ivermectin for many years for chronic parasitic infections and also especially for drug-resistant scabies. And ivermectin is used in South America, particularly for certain patient populations there, because they have a chronic parasitic condition called strongyloides. And it's also been shown that anecdotally that in those people that use ivermectin that they might have some form of benefit when it comes to COVID-19 as well. Being scientists, we need to use medication that have been proven to work, especially in randomized controlled studies. And up to now, the use of ivermectin wasn't that, the evidence for using ivermectin wasn't good in any way. So currently they have cleared the doctors to be using ivermectin, just be sure to understand that we currently don't have medication or the tablet formulation for ivermectin in this country. We only have ivermectin that is available for animal use. And it's very difficult to deduct from that the dosage that you need to give someone, especially if they have COVID-19. So not all practitioners understand ivermectin very, very well, and ivermectin has not been proven in randomized control studies to be as efficacious as what we thought it would be. So hence the reason we're not talking about it too much.
Thank you so much to Mrs. Davids from Cape Town for the question. We stay in Cape Town. Cynthia, Dr. Emile Reid is listening to you. What's your question?
And I just want to know, I've got only 40% capacity, lung capacity, and I've had the pneumonia injection 4 years ago. So I just want to know if I need to take the COVID injection.
Cynthia, thank you very much for your question. I think people with underlying conditions are at very high risk for respiratory tract infections. Hence the reason for your doctor to prescribe the pneumococcal vaccine. And a pneumococcal vaccine actually have 2 vaccines that you have to take round about 8 weeks from one another, and that will give you a lifetime benefit against pneumococcal disease. We also vaccinate our little kids when they are born. We also give them pneumococcal vaccination because it prevents middle ear infections, prevents meningitis, etc. Coming to the COVID jab, and especially for you living with 50% lung capacity, there's 2 things that are important, especially with winter lurking. You need to get the flu jab, like Jamie Lee got, and after that, in all likelihood, also the COVID-19 vaccination. Please be sure that if you get both of them, that you actually take them 2 weeks apart, just to make sure there's no cross-reaction, there's no interference, and that there's no interference also with regards to side effects. So both of you is important, both of the vaccines is important for you, but 2 weeks apart. Thank you, Cynthia.
Thank you to Cynthia, and also thank you to Mrs. Davids from Cape Town for calling in this morning. Also thank you to you, Dr. Emile Reid, for sharing your knowledge on the coronavirus vaccine with us this morning. Now, you at home, stay tuned to your Feel Good Breakfast show as we have another health discussion coming up with Dr. Shahrukh Nara in just a little bit, so don't go anywhere.